focused on contribution towards wealth creation and IP assets creation, demonstrated through proven expertise in architecting, building, and implementing enterprise class platforms and products, digital transformation, business process re-engineering, and consulting and operations management. Basically, he is a mechanical engineer, followed by post-graduation in industrial engineering from one of the premier Indian management institutes, IIT, with a specialization in operations and systems, and a PhD with core concentration on business intelligence. He has attended leadership programs conducted by well-reputed University of Michigan and Harvard University. He is a fellow member of the Institution of Engineers India, member of Indian Academy of Applied Psychology, and a member of Indian Association of Medical Informatics. Currently, he is working as Vice President with Tata Medical and Diagnostics Limited Company. Prior to that, he was working with the TCS, Ramco Systems, Crompton Greaves, and TVS. Digital transformation in healthcare is a major area in which the companies are focusing, and particularly today's conclave, yesterday and today, this conclave focus on Society 5.0. It is relevant to our topic, particularly related to the society in which the digital transformation is occupying the more space. While healthcare has been a laggard in adoption of modern technologies and methodologies, post-COVID, a lot of profound changes are underway in the healthcare industry, with the digital transformation being the key occupant enabler. With the industry and education, this type of people will enable the Society 5.0. On behalf of all of you, hearty welcome to Dr. Sarma once again. Over to Dr. Sarma. Thank you very much.
Thank you so much, sir, for the introduction, and good morning, everyone. So the session for today is on the digital transformation in healthcare, which is driving smart personalized healthcare. So the topics, I'll just put that into three parts. One, we will look into why is digital transformation very important in healthcare. Two, what is digital transformation and what is smart personalized healthcare? And three, we will look at how is digital transformation being adopted. DTX is the short form of digital transformation. So we look at how is it being adopted by various companies and countries. Coming to the first part, why is digital transformation required? Let's start with the first principles for a few things. So let's understand what is a healthcare system, what are the challenges and concerns, and where does the problem lie? I hope I'm audible. I'm sorry I didn't ask this question. I hope I'm audible to all.
Loud and clear, sir.
Oh, thank you so much. Thanks for the comment. So this particular slide actually signifies what is healthcare. So it's a set of blind people trying to describe what is healthcare, and every person has his own understanding of what the issue is there. They have their own kind of solutions that is there, and I don't think I could have found a better slide to describe in picture what is healthcare today. Going on further, a healthcare delivery system. Let's start with a quick definition of it. So a healthcare system, also sometimes referred to as a healthcare system or a healthcare system, I mean jointly put together as a word, is the organization of people, institutions, and resources that deliver healthcare services to meet the healthcare needs of target population. So we just start with this basic definition. And a typical healthcare delivery has got three important stakeholders: the care provider, the care seeker, and the caregiver. The care provider is typically the hospital or the clinics or something, and the caregiver is a consultant, and the care seeker is typically the patient. Continuing further, the paradoxes in healthcare you find is there are three important paradoxes from whatever I've done the research and other things. One is an innovation paradox. See, while the patient has been the center of the universe and all the healthcare is all meant to alleviate the problems that a typical patient would have, but very little has been done towards the benefit of this patient. A lot of innovation has happened towards the drug discoveries, diagnostics, and automation, and etc., which of course have an impact on the patient, but have predominantly benefited the stakeholders like the provider and the caregiver. The second is the resource utilization and the cost. You take a country like India where healthcare is also a state subject. The government has invested heavily in terms of primary health centers, secondary health centers, community health centers, and tertiary care centers. But because of the lack of adoption and proper care of the PHCs, a lot of people rush into the tertiary care hospital, choking the system. And people who all can afford go to the private care, to avoid that particular rush. So you find that there's a lot of money that the government has invested, but that has not been properly utilized, but which is actually should have gone to reduce the cost of healthcare, but in turn it has increased the cost of healthcare because a lot of people move into the private care. The third is the treatment versus care. I think people in the north and other places who have seen Munaba MBBS, or in the southern part, we would have seen Vasul Raja MBBS. This really clears what is treatment versus care. So most of the thing is, while oriented towards the care, but what happens today, the focus is more on the treatment. Going further, this is some slide that gives you the where the system is there. The medical mistakes can kill each week to fill about 21 jumbo jets. That's a kind of medical errors that take place. There's a lack of accountability, poor coordination of care, deficiencies in clinical information records, misalignment of payment incentives to providers, little transparency. 25% of all the patients are harmed by medical mistakes. 30% of all funds expended for healthcare are wasted. And these are all some statistics which currently the today healthcare system have got. Going on further, you'll find that the amount of money that is going waste in the US healthcare is about $750 billion. And it's gone, where all it's going to fraud, prevention failures, inflated prices, inefficient delivery system, excessive administrative cost, and unnecessary services. And also, you'll find that 5% of the patients consume 50% of the healthcare spending, mostly on chronic healthcare. And the kind of money that the US spends is about $2.7 trillion goes into the healthcare. Continuing further on the challenges. So one is the inverse care. We just saw that where the 5% is consumed by 50% is. So people with most means whose needs for healthcare are often less consume the most care, whereas those with the least means and great health problems consume the least. So public spending on health services mostly benefit the rich rather than the poor. And the other point is that wherever people lack social protection, a lot of payment of healthcare is done out of pocket as a service. And this actually drives people to poverty. The record is about over 100 million people annually fall into poverty because of they have to pay for healthcare. And fragmented and fragmenting care, the excessive specialization of healthcare providers, you find specialties, super specialties, all kinds of things, which is a very narrow focus of the disease control programs and discourage a holistic approach to individuals and families that they have to deal with. Continuing for the unsafe care, that's what we saw as the medical errors, poor system design that's unable to ensure safety and hygiene standards, leads to high rates of hospital-acquired infections and all. Misdirected care, that is resource allocation clusters around curative care services at great cost, neglecting the potential of primary prevention and healthcare promotion to prevent. So these are some of the challenges, concerns, and paradoxes that we have in the healthcare system. Continuing further, if you look at from a systems point of view, the success of any system depends upon the ability to decompose and recompose elements of the system. And most important, on somebody or some entity having the authority and resource to align. Most of the systems and industries fall into that category, could be automobile, could be aeronautical, or whatever the other industries are there. But unfortunately, healthcare doesn't fall into this category. Many components of the overall system operate as independent agencies. Healthcare reveals itself to be largely a collection of individual clinicians making care-based decisions on their unique apprentice setup. There is no evidence of systemness in the healthcare delivery. For example, even if you take a very complicated and complex thing like an airline, we don't say there is so-and-so is a best pilot or so, though it could be the most largest and complex more machine. But in the healthcare system, we still say this is so-and-so is the best doctor, so-and-so is the best surgeon at all. So healthcare is still a cottage industry, and not all system design and management problems can be addressed through this kind of a decomposition, and healthcare falls into a specialized category called as complex adaptive systems. So typically a complex adaptive system follow these kind of characteristics. One, they're non-linear and dynamic and do not inherently reach fixed equilibrium points. As a result, system behaviors may appear to be random or chaotic. They're composed of independent agencies whose behavior is based on physical and psychological or rules, social rules, rather than demands of system dynamics. Because agents' needs or desires reflected in the rules are not homogeneous, their goals and behaviors are likely to conflict. In response to these conflicts or competition, agents tend to adapt to each other's behavior. Agents are intelligent. As they experiment and gain experience, agents learn and change their behaviors. Thus, the overall system behavior inherently changes over time. Adaptation and learning tend to result in self-organization. Behavioral patterns emerge rather than being designed into the system. And the nature of the emergent behaviors may range from valuable innovation to unfortunate accidents. So there is no single point of control in a healthcare system. System behaviors are often unpredictable, uncontrollable, and no one is in charge. Consequently, the behaviors of complex adaptive systems, CAS as they're called, can usually be more influenced than controlled. So healthcare typically falls into this kind of system behavior. So where does the problem lie? Like all other industries, healthcare, in order to become more efficient, more responsive to patients and other things, they need to have two important things. One is a value driver. The nature and extent of B2C, that is business to consumer service, determines the service value determines the business to business as well as the value of products and other value enablers. In the context of healthcare, the value provided to consumers and the payment received for this value determine the financial potential for all other players in the network. There is a very important ratio that we use in the study of industries, one that is called as a B2C complexity to the market complexity. This is a ratio. This ratio tends to decrease as markets mature. The most successful player in the market are those who contribute most to this decrease. To accomplish, they usually have to increase the business to business complexity, which often increases the total market complexity. However, this is done in a ways that decrease the ratio of consumer complexity to total complexity. Now coming on to our healthcare, so you would find that an healthcare ecosystem is made of so many people: public, private labs, pharma companies, patients, investors, charities, government regulators, AIM health and medicine, technology providers, insurance companies, and no single industry or a participant has all the assets to solve these problems. So healthcare problems are sometimes also called as wicked problems, where incentives are often misaligned that require collaborative approach to be solved. So given this, so how do we solve this? The potential today we see that lies in the digital transformation, which we will explore in part B. So now let's look at part B, which is what is digital transformation. So before we go into defining what is digital transformation, let's look at the drivers. One of the important drivers are the technologies. Of course, most of you would know that we are today in the industry 4.0 and we're talking about 5.0 also. The 1.0, we started off mechanization and all. Then there was mass production in the industry 2.0, and 3.0 talked about automation, computers and electronics. And today we are talking about cyber physical systems and Internet of Things and networks. So this has come up because of these kind of emerging technologies. We have 3D printing, 5G, artificial intelligence, augmented realities, automated guided vehicles, blockchain, cloud, cobots, cyber security, digital twins, drones, edge computing, Internet of Things platforms, machine visions, quantum computing, and virtual reality. So these all technologies are one of the important drivers of digital transformation. The second important driver is the business itself. There's a fundamental transformation of business that is there, which is digitization, ubiquitous connectivity, and globalization. Typically, the value that used to be delivered about 30 or 40 years used to be products. People used to sell product and that's it. Then slowly the product era moved into solutions era. So not only we give product, we give you service, we give you spare parts, we give you AMC. So a solution evolved around it. Today, what is being sold is not the product, not the solution, but the experiences. For example, let us take a simple thing like a movie going itself. Today, one can see a movie on a Netflix or something with paying really hardly any amount of money. But then people tend to go to multiplexes, etc., paying 200, 300 or 400 rupees to just get the experience of seeing the movie. So what is being sold at a premium is an experience. So people want individualized, personalized experiences, which is going to be the selling factor. And every nature, and it is impacting every nature of the firm and how a firm creates a value, and no industry is an exception, so is also healthcare. So the value that a company creates or organization creates is through unique, personalized experiences of consumers. There's a centrality of individuals. There was one point of time, this was a famous statement by Mr. Ford. He said, any color of car is okay as long as it is black. Those were days in 1940s and other things. But today we have a 180 degree model to that Model T, where people can choose and the color of the car, the combinations, whatever they got, you can actually design your own thing. So no company has all the resources to deliver these unique experiences. Hence, collaboration is the key. So these are the two important drivers. One is a technology and one is a business, which is driving digital transformation. Let's formally define what is digital transformation now. Digital transformation healthcare is making use of the latest technologies, methodologies, and processes to deliver sustainable value to patients, healthcare professionals, and healthcare organizations. It's basically about embracing and employing advanced technologies and innovative approaches to maximize benefits. What are the transformation trends like we talked about? Healthcare wearables, data in aggregations, on-demand healthcare, AI screening, patient portals, telehealth and virtual doctors, disease history analysis and all. What are the benefits that people see on a healthcare transformation? Is reduced cost, optimized workflows, enable improved interaction with patients, secure database for electronic medical records. The benefits that is there for patients is better track health metrics in real time, convenient appointment scheduling, easy access to personal health data, better communication with doctors, and better and more personalized services. Just look at the market, what we have. The global digital market size is expected to be about $430 billion by 2028. There's 95% of the health system agree that it's crucial for the organization to achieve investment in digital transformation. There's a 30% increase in the compounded annual growth for the global digital market, and 84% of healthcare providers consider digitization to boost personalization. So given this, let's look at what is the digital transformation. So digital transformation is actually a hierarchical thing of three important elements. One is a digitization, where the first step is to digitize the information, change from analog to physical form, organize the information properly. Then we went into digitalization, where they automate processes and streamline the processes, where digital technologies and information used to transform individual institutional operation. We are in the third phase of, that is a digital transformation, where a series of deep and coordinated cultural, workforce, and technology shifts that enable new educational and operating models and transform an institution operation strategic directions and value proposition. We are in this phase. Sorry. All of this is resulting in and transforming how we access the care, the front door to care, which is network navigation, virtual triage, and network optimization. The transforming how we pay for the care. This is the fintech for healthcare, the financial clearances, payments, and novel coverage products. And transforming how we experience care, the frictionless encounters of which provided through platform, full stack providers, digital care management platform, and interoperability engines. A typical digital transformation process consists of three important steps: formulating a digital strategy, defining the scope and coverage of a digital transformation, and the digital engineering and architecture. Typically, the digital transformation looks at three important pillars: the customer experience, the operational process, the business models. The customer experience looks at customer understanding, the top line growth, the customer touch points. The operational process looks at process digitization, worker enablement, and performance management. The business models looks at digitally modified business, new digital business, and digital globalization. So these are the three important pillars to arrive at a digital transformation. Now, these are the various applications, digital health applications that we have seen today in the market. For example, the healthcare information, the knowledge generation, knowledge integrators, personal health devices, which include mobile assessment, monitoring and tailoring, telemedicine, diagnostic space, imaging, pharmaceuticals, implantable devices, surgical, personalized therapeutics, geospatial environmental. These are all the various digital applications we are seeing, which is driving what is called as a personal healthcare. Now let's look at what this personal healthcare really means. The future physician or the medical engineer is, will physicians become medical engineers overseeing nanobots augmented by smart technologies? For example, a medical engineer hundreds of miles away from the actual point can monitor and treat more than 50 patients at a time. Advanced nanobots can perform medical intervention. And will medical parks unlock remote care at seemingly today unimaginable scale? Then we have got the future smart homes, where there's a genomic sequencer, scans breakfast, checking for signs of E. coli. You could have smart watches for monitoring lethargy, smart tattoos, which can measure the blood and tissue recordings. And there are 5 irrevocable facts that continue to force a shift in the industry traditional models, which is smart health. One is the socioeconomic factors. Care will continue to take an even large share of GDP as obesity and chronic diseases are increasing, so which will require a greater proof of value. Required capital efficiencies. Pressure moves from productivity and efficiency challenges to innovation with intelligent modernized infrastructure. There are enormous amount of workforce shortages. 18 million predicted shortfall in global health care force by 2030, which will need a shift towards virtualization, automation, AI, technology integration, conversion to virtual, personalized and preventive models will require integration of new capabilities. And consumer acceptance of smart devices to require care will reshape care delivery, which will require change in business and clinical models. You will see that because of this, we see 8 key changes in the traditional health model. 1, the point of care is shifting from hospitals to home. The data ownership changes from institutions to consumers. The reference point is population to individual, which we talked about the personalized healthcare. From a physician's role, authority to a guide. Data interrogation is separated to integrated. Interactions become from physical to virtual. Access times become from availability to on demand. The structured arrangements to fluid access, the collaboration. So these are the kind of changes that we are going to see with the technologies coming in. And also the healthcare data is growing up enormously. The growth in the volume of data is 6% in financial services, whereas it's 36% in the case of healthcare data. The 1 trillion sensors in the world in 2020, which is growing at 185% since 2010. And in 2021, every person on the planet generated about 50 terabytes of data. So you'll find that's a huge amount of data that is coming to the system. And then you would also see that the future, we will continue to see new technologies. The cloud computing, sensors, 5G technology, and virtualized will now shift to quantum computing, the spatial web, the web 3.0 and metaverse. So medicine will no longer be a clinical science supported, but it's already moving to data science supported by clinicians. You'll see a lot of Internet of medical technologies coming in. At the personal level, in and outside the body, you have smart patches, smart clothing, embedded pills, smart dust, biometric tattoos, nanobots, etc. Your smart home, your sleep and nutrition trackers, motion sensors, autonomous vehicles with sensor arrays connected to smart city infrastructure, smart furniture, ambient vital signs sampling, virtual assistant, connected appliances. Then you have a smart specialist care facility with AI-enabled robots, drones, and virtual assistants, AI surgery platforms, integral comprehensive diagnostic environment, IoT trackers, 24/7 virtual care monitoring, and always an access to multidisciplinary care team. And today AI is getting more and more promising. So you'd find that the FDA approvals for AI algorithm is increasing over time. About 275 AI algorithms have been approved in 2017. As early as February 2022, we have WITS.ai wins approval for AI that detects cerebral, this one, the algorithm input for cardiac imaging. So a lot of AI algorithms are coming in to help the clinicians. Basically, what we are seeing is this data is playing a very important role to deliver personalized healthcare. There's an access to data, connect the data streams, analyze the data streams, create value, combine the data sets, analyze the data sets, create more value, share access and insights, analyze the data insights, create more value, target therapy and care, make care more human. So this is what is that we are trying to see in the future coming up, where there is sharing of insights and continuous learning. And data and technology, continuous learning becomes more intelligent and the health value is increasing. So what we are essentially seeing is an ecosystem of these things coming up, where you've got sensors that systems collect and personalize data. There's a smart comparison to patients' baseline and real world evidences. And then there's a personalized actionable insight that are generated, which give informed clinical intervention, continuous monitoring via sensors, optimization of personalized treatment, where you can adjust the doses and all. So what we're looking now is, can AI be able to simulate human behavior in terms of sense, perceive, learn, know, reason, plan, and act? So we got multiple AI technologies which you know of: constraint satisfaction solvers, path planning algorithms, knowledge graph, ontologies, machine learning, etc. We got enormous amount of use cases like digital triaging, care pathway optimizations, behavioral coaching algorithms, remote patient monitoring, smart risk monitoring, in silo testing, smart trial recruitments, fast deeper genomic analysis, real-time disease management, and all. So essentially what we are moving out is from an analog sequential care to a digitized care to a connected care and a smart health system, which is actually pushing and pulling data to and from the edge. Patient is at the centers, silos between care settings are completely broken down, and a connected healthcare is being given. So the intelligent ecosystem is actually going to be hyper-connected with super fluid data flows, have fast real-time operations, operate human AI, deliver personalized care and health experiences. So in summary, the data is the fuel, the science and technology compromise engine, the insights are personalized, measures are equally clinically and non-clinical, and the user experience device, which is demonstrated by the health outcomes. So all this is resulting in what? It gives access to real-time healthcare information, data privacy, remote patient monitoring, preventive care, and better ROI, eliminates human errors, timely assistance, improved care to patients, efficient healthcare analysis, and efficient patient engagement. So now we have seen what is smart personalized healthcare. Now we go to the third portion, which is how is adoption of digital healthcare. Let us take our own country of India. I hope most of you have heard of National Digital Health System, which is announced by the government, which is a combination of several of these entities: hospitals, clinics, labs, third-party insurers, health tech companies, modern medicines, practitioners, all these people. The objective of the NDHM is to create an ecosystem that supports universal health coverage in efficient, accessible, inclusive, affordable, and timely and safe manner, through provision of wide range of data, information, infrastructure, duly leveraging open, interoperable, standards-based digital systems, and ensuring the security, confidentiality, and privacy of healthcare personal information. The typical framework looks like this. The government-owned organization will drive the policies and everything. There's a governance structure. The vision is to be the best healthcare network globally, to provide every Indian with access to digital health services. The services will be PHR, which is personal health record, registries, health IDs, open API, data management, technical architecture. The two important domains that they talk about, the health domain and the technology domain. And the objective is to ensure availability of services on wider scale, to address human resource gap by efficient and optimum utilization of resources, to provide healthcare services in remote and inaccessible areas through telemedicine, to improve patient safety, to monitor geographically dispersed tasks for meaningful field level interactions, to help in evidence-based planning and decision making, and to improve efficiency in imparting training and capacity building. So if you look at the principles and the architecture from the tech standpoint of view, the domain principles and technology principles will more focus on the technology principle. This is how the architecture looks like. There are five layers. The bottom, we have the infrastructure layer, the data hubs, the technology building blocks, the application building blocks, and access and delivery. We'll see each one of them in brief. The infrastructure block talks about the secure health networks, the health clouds, security and privacy operation center. The secure net health will be a blueprint which will run on the VPN. For specific applications like telehealth, teleurology, which requires like PACS and all, the network would be specially designed. There will be a health cloud, which will be built by MIT Initiative Government Community Cloud, which will provide the health cloud. And the security and operation centers will provide all the security and the privacy things that are required to drive this. This is layer one. The layer two talks about the data hub, where we talk of personal health identifier, the personal health record, and the health master directories. The personal health identifier is the unique identifier for every patient and for every citizen rather. The health record generates an aggregate health records for a person and puts the information control a person to share it with consent. Healthcare providers are expected to identify the individual through PH, insert a medical record into person's PHR after providing care. There's a DigiLocker system that is being there, where multiple users can exchange data with consent. And the health master directories will be there. The directories will be disease registries, donor registries, facilities directory, doctors, nurses, paramedics, etc., which can actually help in optimizing the resources. And the directories will build a strong ownership and governance mechanism and adhere to the principles of single version of truth. We come to the third layer, which is actually the technology building blocks, the anonymizer, which takes data from the health locker, removes all personally identified information to protect privacy and provides anonymized data. Consent manager, which takes a consent whenever any record has to be exchanged. Health locker, which is a standard-based interoperability specification to hold various records. Health information exchange provides a protocol for exchanging healthcare information across applications. The health analytics provides a decision support for stakeholders on a variety of themes by aggregating data sets and all. We have the layer 4, which is application building block, where the applications can run across emergency care, healthcare, wellness, medical education, etc. And there will be government managed healthcare applications like reproductive and child healthcare, NICSHI, or you'll have health information system like Raktosh or National Program for Control of Blindness. Like these are all various applications managed by the government. You could also have the private sector applications also interacting with all these things and all. And the layer 5 is access and delivery. It could be the call centers, India Health Portal, the social media, and My Wealth apps and all. And all of this is driven by the vertical layer of national health standards, command, control, and communication center. So this is in brief about the architecture of what is there. It has got the 5 layers, the national health standards, and command, control, and communication running across all the 5 layers. Now let's look at what countries like China and etc. are doing. The internet future, they're also looking at smart city. The government functions, policy making and all is governed by them, like our NHDM, smart healthcare service system, disease prevent and control system, emergency medical systems. There's a smart city healthcare platform for disease control, remote diagnostics, remote treatment, supply chain, smart health and insurance and all, which is leveraging 5G, cloud computing, AI, VR, big data, Internet of Things. Then let's look at some of the big tech companies. What they're doing is that, for example, take a company like Amazon, and this is as late as 2022. So they're more into building for consumer care provision. For consumer and employee health, they bought our One Medical, and these are the various companies that they have made investments. Diagnostic and therapeutics, these are the various companies that they have made investments, and they have a partnership with Novartis. Care coordination and remote monitoring, they have Harmony Health Clinic and other things and all. So these are the ecosystem of applications that Amazon is building for consumer care provision. Let's look at what Google is doing. Google is targeting life sciences and data. So for AI drug discovery, R&D and all, they got this set of application. They're partnering with these people. AI radiology and imaging, they got various of these applications. And they're also tying up with Mayo Clinic and other things. For medical data, they got these things. So this is how Google is targeting life sciences and data. Microsoft is prioritizing provider development tools. So they would like to provide tools for development for building very, very innovative applications. Clinical IT solutions, they're partnering with these people. Diagnostic and therapeutics, healthcare enterprise cloud tools, healthcare enterprise IT. So this is the ecosystem of what Microsoft is investing in. And if you look at Apple, Apple is focusing more towards consumerizing of the healthcare, offering a lot of apps for fitness and other things, so their wearables and integrations and everything and all. And it has got 51 like activity tracker. It has got where your activity rings, coaching, etc. It can do. For health heart, high low heart rate notifications are there. ECG app is there. Other things, mindfulness and education, COVID-19 related things, hand washing and safety, sleep, respiratory, mobility, hearing health, women's health, medications, and there are a lot more other apps. So they're focusing more on developing apps which can enhance the consumer and empower the consumer in doing that. Oracle is focusing on centralizing the whole thing at one place. They're taken over Cerner very recently. Providing and put a lot of investments in the cloud to provide that. So this is how the big tech companies are doing. And let's look at what the future of healthcare is done. This is a study done by the Economist. So what they did was they empaneled experts in the field of healthcare to predict what technologies and innovations they will see in the near term, that's next 5 years and next 25 years. And then they surveyed about 400 odd global business leaders in healthcare and found out whether they agree or disagree in what kind of things they're looking for. In the US, in the next 5 years, you're looking at genomic analysis, AR and AI and medical decision support. And in the next 25 years, you're looking at designer babies, nanotechnologies, and hospital redesign. So is also European EU, which is looking at genomic analysis, robotics, and AI and medical decision support, looking at designer babies, aging research, and brain-computer interfaces. Asia is no different. We're also looking at designer babies, 3D printed organs, brain-computer interfaces, etc., and all other countries. So there's a tremendous amount of shift that is happening in the way the healthcare delivery is going to happen. There's a paradigm shift in which each one of us are going to experience. And the key thing is going to be personalized healthcare, moving from illness to wellness. So that is in summary of my presentation of part A, part C. To just summarize, we saw why is digital transformation required in healthcare. We also looked at what is digital transformation, what is smart personalized healthcare. In why we looked at why healthcare is still a cottage industry. It doesn't follow the generic system rules. It follows a complex adaptive system. So that's why digital transformation play a very vital role, and that's what is being done today. We looked at various technologies and what are the processes and what the digital transformation is all about, and how these technologies are driving smart personalized healthcare. And we also looked how various countries and technologies are adapting. We looked at India, which is going a major way through National Health Digital Mission. We're looking at big tech companies like Google, Amazon, also acquiring and building up with their own ecosystem in the healthcare. And the next, how the future is going to look for. So this is in summary. And thanks to the entire team of RMK and especially Mr. Chandrasekhar Kesavan for providing me this opportunity for presenting this particular session. And thanks everybody for giving your time. And that's it from me, sir.
Thank you, Dr. Sarma, Vice President, Tata Medical and Diagnostics Limited, Chennai.